Is the chair of Social Security Systems Administration and Management Studies at Wits University. Thank you for being with us. Prof, what do you think of this?
Well, I think there are a number of issues that need to be resolved. I think that one thing that is frustrating a lot of people is the fact that government hasn't got its ducks in a row in making the transition. But I do believe that it's necessary to be extremely careful in shifting the regulations into other acts. And I think that we have to be very cautious on how this legislation is translated out into other legislation outside of the Disaster Management Act. And I think that that's probably where some of the delays lie. It's a lot more complex than one would think.
Is it complex? I mean, just explain. Can't we just reintroduce the state of disaster were there to be another very fatal wave? Why do we have to go through this whole legal process, as government calls it, to manage the pandemic in future?
So there's one piece of legislation of regulations that should have been shifted very quickly, which is the COVID SRD grant, which was created in terms of the Disaster Management Act instead of the Social Assistance Act. And transitioning that regulation needs to be done quite quickly, but the transition might have hit a few hitches because government wasn't all on the same page with respect to that program. That's the one part, because you can't just suddenly withdraw the grant from 10 million people. That's quite aside from the restrictions. In terms of translating certain provisions into the National Health Act, it would make sense to allow the Department of Health to have some control in responding to epidemics in general, but not to give the powers to the Minister of Health to lock down the entire country and destroy the economy on his or her own. So I think that those are issues. How far do you go in the National Health Act before you rather create a provision that requires the final determination to be made by Cabinet as a whole? And I think that that's probably where the discussion lies. And it does raise the question, as you've put it, that perhaps one should leave disasters to the Disaster Act. And when it's less than a disaster, it can be managed with lesser interventions. But it's got to be very clear where the boundaries lie in certain kinds of responses.
This is interesting because it appears that one sticking point, and this is according to Minister in the Presidency, Mondli Ngumbele, is that government won't be able to implement curfews or suspend alcohol sales in future if there is another wave. But is that valid? Surely we want the law outside of the state of disaster to have minimal impact on our freedom as citizens.
Well, I think that, so first of all, there is an issue that Professor Badi raises, which I think is quite legitimate, and that is that quite a lot of these interventions didn't really have a very big prevention effect at all, and probably won't have in future. So that's if you're trying to prevent infections. So right now, our key focus is on preventing severe illness, which is through vaccinations. And then we've had a lot of people who've actually been infected even if they weren't vaccinated. So quite right now, we do have, certainly against COVID-19, we've got a lot more protection against severe illness than we had in 2020 and 2021. So I think that that's a question as to whether or not effectively the disaster is over. But prevention itself and the mechanisms we've used to date have been singularly unsuccessful in the South African context. And I think there will be quite a lot of evaluation of what's happened to date. But there's no indication that what was done actually worked very effectively.
Yeah. Finally, it's been said to me that maybe it'll be difficult to tell people to stop wearing masks, for instance, which has been done all around the world. But then all of a sudden we'll all have to start wearing them again, getting used to that. Is there any justification to keep low-level regulations in place for a very long time, which seems to be the stance of South Africa right now? Or do we have to say, no, we have to respect freedom and not do anything without clear justification around health or preparing hospitals, etc.?
Yeah, so mask wearing, for instance, outdoors, it's quite clear, makes no difference whatsoever, and could be eliminated tomorrow as a restriction. even in sort of relatively crowded areas. In indoor settings, right at this point, consistent with much of the world that has had severe infections to date, unlike China, for instance, and Hong Kong, you can potentially look at people wearing masks on a voluntary basis in indoor settings and basically protecting themselves if they feel vulnerable. But to have a general mask wearing policy at this point is probably of no real benefit. But I don't really think that mask wearing indoors in certain settings is as much of a hindrance as, for instance, a curfew and shutting down venues, which is quite destructive to the economy and also has very limited effect on prevention. So I think that at this point in time, the question is who should make the call on mask wearing. So at this point in time, probably it's not needed. If we have a fifth wave, we're probably not going to have many cases. We will have some severe illness, but probably it's going to be at a far lower levels than any time in the past. And therefore, the question really is whether or not at this point in time it merits having a severe restrictive framework in place. So I think that the other issue is that everybody's had the opportunity to get vaccinated up to this point, to protect themselves at least from infection to some degree and severe illness through vaccination. And if people have not made use of that possibility, the question really is, of that opportunity, the question now is how much responsibility must the rest of society have for protecting those people? And I think that all points to the fact that we do have to move on now.
It is a complex issue, like you say, and who should decide? Thank you very much for that view. Professor Alex van den Heever from Wits University, responding to the state of disaster being extended yet again today.